Point of care testing. All right, so point of care testing is also known as alternative site testing. So point of care testing may be performed at the bedside, in intensive care unit, emergency room, in outpatient settings like a doctor's office, nursing home, assisted living center, or even the patient's own home. So point of care testing refers to the performance of analytic tests immediately after obtaining the sample, generally in that same room. So we call that point of care. By bringing the laboratory to the patient, the turnaround time for obtaining test results is shortened, allowing more prompt medical attention, faster diagnosis and treatment, and potentially decreases recovery time. Most tests performed as point-of-care tests are considered waived by CLIA. So a CLIA waived test is not subject to regulatory oversight by government authorities. There is an essential feature of a CLIA waived test. So the testing equipment and procedure are so simple and accurate that erroneous results are unlikely to occur. In general, point-of-care testing instruments are also easy to use. The required training is simple, and they can be used by a variety of medical professionals like phlebotomists, nurses, nurse assistants, and physicians. So the quality assurance and point-of-care testing, just because it's a waived simple test, does not mean that we don't need to worry about quality assurance and controls. They are still essential for using point-of-care testing, just as they are with other laboratory tests. So there is strict adherence to guidelines regarding calibrating equipment, running those controls, performing maintenance, and keeping records for a point-of-care test program. Failure in any one of these areas can lead to erroneous results and negative consequences for patients. So finally, there's proper and adequate training for all personnel performing these procedures, and it is critical to implement this for a successful point-of-care test program. Point-of-care test. So there are quite a few that can be ran as a point-of-care test. I will say the most common that I have seen at least is glucose and hemoglobin. There is also BNP, troponin, cholesterol, ACT test, PT, APTT, and other chemistry panels. So hematology, the most common hematology test performed as a point-of-care test is actually your hemoglobin, which is a simple, fast method of anemia testing, and it uses a handheld hemoglobin analyzer like the one shown in the picture. You can also do hematocrit. Reading is sometimes made at bedside or at the clinic office as well. Coagulation, we can monitor coagulation to monitor patients with clotting disorders who are receiving therapy. It can also be used for patients who are on warfarin, which is a blood thinner, or Coumadin as well. So heparin therapy may be monitored by determining the ACT test. And activated partial thromboplastin time, or the APTT, can also be used to monitor heparin therapy. Chemistry, lots of times it's a glucose test, so you probably have heard of a glucometer or something like that. This is a bedside glucose monitoring. Like I mentioned, it's the most common one. They do this all the time on the floors at the hospital. And the glucose is determined with a dermal puncture and reagent strips, and it's actually a whole blood sample. You can also do an ancillary blood glucose test. So the ancillary blood glucose test is performed at bedside, most often for patients that have diabetes mellitus. Because different manufacturers have somewhat different procedures for their machines and test strips, make sure that you read and understand the directions for the one that you are actually using. Control solutions must also be run using the same procedure as for the test. Hemoglobin A1C can be analyzed as a CLIA waived test using a handheld portable testing monitor. It can also be used at the bedside as well. It can provide immediate results. The test will monitor the long-term effectiveness of diabetes therapy by providing a reading of the hemoglobin A1C, which is a protein related to the average blood glucose level over a period of 4 to 6 weeks. Cardiac troponin T and troponin I. So cardiac troponin T and I are part of a protein complex in the cardiac muscle that aids the interaction of actin and myosin. So damaged cardiac muscle will release cardiac troponin T and I. So the plasma level of the cardiac troponin T rises within 4 hours after a heart attack. You can also do a bedside determination, can be performed using whole blood, and they'll have the results within 15 minutes, which is a bit quicker than if they were to do a whole blood sample and then send it down to the lab. So monitoring the troponins can provide valuable information for a patient with a possible myocardial infarction. We can also test lipids on a point of care test. So cholesterol is a type of lipid, and cholesterol levels may be determined as part of a routine exam or to monitor therapy with patients who are on cholesterol lowering drugs. The blood is going to be applied to a card, and the color determination is made after the reaction takes place within the cartridge of the analyzer. Other cholesterol point of care test methods can use instrumentation as well. Blood gases and electrolytes. So there are several instruments that are available that can analyze arterial blood gases, which is the concentrations of oxygen and carbon dioxide and pH levels, and common electrolytes as well, such as sodium, potassium, calcium, chloride, and bicarbonate. Because of their complexity, all these instruments require careful calibration and more training than other instruments like the hemoglobin analyzers and such. The BNP, also known as the brain natriuretic peptide, is a hormone made by the heart in response to expansion of ventricular volume and pressure overload. The measurement of BNP at the bedside can help allow the practitioner or physician to quickly differentiate between COPD and congestive heart disease, which may have similar symptoms. So this would help them to determine what is causing these patients' symptoms. The C-reactive protein, or the CRP, is actually an inflammatory marker that is used to help monitor inflammation in certain autoimmune diseases and post-surgically to monitor post-operative infections. Elevated CRP is also a risk factor for heart disease and may be a better indicator of risk than low-density lipoprotein or your LDL cholesterol level. There are other CLIA wave tests as well, and this number keeps growing because of advances in bioanalytic chemistry and recognition that such tests can allow more flexible delivery of care by a wider range of staff. So the following tests are commonly performed as CLIA wave tests, though not necessarily at the bedside like point of care with handheld instruments. So occult blood, as mentioned before, this is the one that's looking for that hidden blood. So the stool sample is placed on the card or slide, and the reagent or developer solution is then added to that test area. Urinalysis, there are many common requested urine tests that can be performed using that dipstick. It's a plastic strip that has reagents embedded on it. And the tests that we can test for a urinalysis are pH, protein, glucose, ketones, bilirubin, urobilinogen, blood, leukocyte esterase, nitrite, and specific gravity. The urinalysis, so the color change on the strip is going to be compared with the reference color chart on the bottle at the appropriate time. So essentially you're going to dip that dipstick in to the urine, and then you're going to blot it, the excess urine, off of the strip, and then you're going to just basically compare the colors. If it's changed color, then you're going to compare it to what it shows on the bottle, and that will give you your test results. Pregnancy and infectious disease. So a pregnancy test detects the presence of human chorionic gonadotropin, or HCG, which is a hormone that is produced by the placenta after there's implantation of a fertilized egg. The HCG hormone is present in both urine and serum, and there are test kits for both. So there are a lot of point-of-care test kits also to detect infectious diseases, and these tests are provided as kits that come with all the necessary reagents and test cassettes needed to perform that test. One of those kits is a rapid group A streptococcus, and this is testing for strep from a throat swab. The procedure usually requires extracting the sample to isolate bacterial carbohydrates, which is then followed by the addition of reagents and the development of a color change. Another one is RSV, or respiratory syncytial virus. This RSV infects airways and may cause inflammation of bronchioles, especially in young children. The point-of-care test uses either a nasal wash or an NP swab. Influenza A and B. So that's kind of the main types of flu is A and B. The influenza A and B test will usually detect both and can distinguish between the two. So it can tell you if it's flu A or flu B. The test is performed on a specimen collected by a nasal swab, nasopharyngeal swab, nasal wash, or nasopharyngeal aspirate, which is the fluid that is withdrawn under suction from the rear of the nasal cavity. A single sample can be used to run both the tests for A and B. Helicobacter pylori, this is a bacterium that is found in the stomach that can cause ulcers. There are antibodies to the bacterium, which can be detected with a point-of-care test with whole blood as the sample. Infectious mononucleosis, also known as mono, which is caused by the virus called Epstein-Barr virus, so EBV. This causes a sore throat, fever, and swollen glands. The point-of-care test will actually detect the antibodies to the Epstein-Barr virus with whole blood as a sample. Human immunodeficiency virus, or HIV. So this attacks T helper cells in the immune system, which may cause the acquired immunodeficiency syndrome, also known as AIDS. The point-of-care test detects antibodies to human immunodeficiency virus, or HIV, with whole blood as the sample, and the patient must provide written consent before this test is conducted. Ancillary blood glucose tests, you would perform a routine capillary collection. Some manufacturers do not recommend wiping away the first drop, so make sure you read those recommendations and know what your facility's protocols are. To collect the sample, you're going to collect a blood drop directly onto the strip. You're going to cover appropriate area on the stick with a free-falling drop of blood. And be careful not to touch the strip yourself or allow the patient's skin to touch it, as that could give you false results as well. And then you're going to read and record the results. Values that are well outside the range of normal should be reported immediately. And again, you're going to follow your policies or your facility's policies on what you would do for those types of situations. All right, so there is an increasing demand for multi-skilled personnel that can develop the ability to perform electrocardiography, which is an EKG, and a lot of times in certain doctors' offices, phlebotomists are actually responsible for doing this. So it's beyond the scope of this chapter to give a complete introduction to this topic, so we're going to briefly just go over it here. So electrocardiography is a method for recording the electrical activity of the heart. The output of the electrograph is a tracing called an EKG or an ECG. The EKG is used to diagnose heart diseases such as ischemia, myocardial infarction, and fibrillation. The cardiac cycle. So as you learned in chapter 7, each heartbeat cycle includes a contraction and relaxation of each of the 4 chambers of the heart. This contraction is triggered and coordinated by electrical impulses from the heart's pacemaker called the sinoatrial node. It's located in the upper wall of the right atrium. The electrical activity occurring during the cycle is then recorded on the EKG. The normal EKG consists of tracing with 5 prominent points where the graph changes directions. So a lot of times these are going to be known as P, Q, R, S, and T. The electrocardiogram measurements, so you have a P wave, which is the atrial depolarization, the PR interval, which is the time between atrial contraction and ventricular contraction, the QRS complex, which is the ventricular depolarization, and then the ST segment, which is the time between ventricular depolarization and beginning of repolarization. T wave is ventricular repolarization, and QT interval is the time between ventricular depolarization and completion of repolarization. Electrocardiogram equipment. So the electrical activity of the heart is recorded with 10 numbered electrodes that are placed in certain locations on the patient's chest, arms, and legs. There is a wire that is attached to each electrode. The wire passes to the EKG machine through a cable, and the tracing is made on heat and pressure sensitive paper by a stylus. The electrodes may be applied with an electrolyte solution to help increase that conductivity if needed. So performing an electrocardiogram, the patient should be wearing a gown that opens in the front and the lower legs must be exposed. The patient should be lying down and must remain still during the EKG. And many EKG machines automatically cycle through the 10 electrodes. The machine and the patient should be positioned away from the electrical equipment, including televisions, air conditioners, and other functioning appliances. Electrode locations are cleaned with alcohol and shaved of hair if necessary. Disposable adhesive electrodes are available, or electrolyte cream or gel is applied if reusable electrodes are being used.